Thank you so much. I have a feeling that mine is not the only tearful eye in the room. So thank you very much for being here with us today to celebrate Save the Children's 75th anniversary, and also to raise the awareness and understanding of this important issue, the mental health and psychosocial well-being of children, youth, and families. This has been an interesting journey this morning. I'm very touched by all of the speakers who have come before. And I think also in these unprecedented times where we have some of us here together to really feel the energy of what was just shared with us in those personal stories. But when we think about journey, for those of us who work in this field, we really indeed can trace its origins back to the world wars. And I began working in this field during the Balkan Wars, and I have many colleagues here in the room, and we have colleagues on the live stream who have worked the last decades for MHPSS, mental health and psychosocial support of people impacted by war, disaster, HIV/AIDS, Ebola, and of course, most recently, the COVID-19 pandemic. In 2007, we achieved something important, and that was a common term, a shared term, MHPSS. And this shared term came with the publication of the IASC guidelines for MHPSS in emergencies. And it's an important term because it encompasses the spectrum of care and support that we deliver. And Anne-Sophie laid this out so beautifully this morning. It's how we deliver basic services in security and crisis settings, how we create learning environments where children are not bullied, where they're not beaten by their teachers, but rather nurtured and protected, how we help new mothers who have faced war and displacement to recover themselves, to find peer support, and then to be better able to provide the positive stimulation that their babies need to get a good start in life. It's also how we provide more focused care to children, youth, and their caregivers who are survivors of rape, abuse, violence, and torture. And also further, how we treat conditions such as mental disorders, substance abuse problems, developmental disabilities in children. And these are things that cause an enormous disease burden on societies. There really is no health without mental health. Right? And it's also how we do all of these things integrating cross-sectorally. So we integrate within health, within education, with schools, within social service systems. So the term is MHPSS. And 2.5 years ago when we started the collaborative, we had a really tough time getting people to use the term. They said, oh, it's too complicated, MHP. But today we hear it rolling off the tongues of ministers and people in government. We hear this term being used, and this is in itself an achievement. At the collaborative, we've had a way of translating this term, and in this we draw from the words of the great Martin Luther King, who talked about the beloved community. And for us, the beloved community is really the way that we understand MHPSS and what we're trying to create for children, for youth, and for families. And it is the community that nurtures children and raises them to adulthood, that surrounds teachers and caregivers to ensure their well-being through serious adversity, so that they can then create the environments for children and youth to develop to their full potential. On this slide, you can see the landmark events from 2018 to 2022 as our global community has taken up the urgency of MHPSS. So our beloved community is growing, and it's uniting in the rich exchanges that we're seeing between our friends in the Dutch ministry and our friends in the Danish ministry. It's also growing across geographies and generations. Through your presence here as well as the many youth and adults from around the world who are joining us in the live stream. This afternoon, we will dive deeper into the work of MHPSS with 3 sessions. In the first session, We will report on the actions that have been developed by our global MHPSS community, both youth and adults. We were really, really privileged to be joined by a wonderful group of youth organized by United for Global Mental Health. I learned so much from them. We all learned so much from them. But the youth and adults together reflected upon the 4 child and adolescent recommendations that came out of the 2019 Ministerial Mental Health Summit in the Netherlands. And these are actions that we hope to carry forward. We're carrying the torch forward to the events that are going to be coming up in the fall of this year on those recommendations. You can also see those recommendations on the conference app. In session 2, we're going to be talking about investing for impact, scaling and mainstreaming quality MHPSS across sectors and institutions. Marie Dahl, the head of the MHPSS unit at Save the Children Denmark, will welcome Ambassador Beckers from the Netherlands, Special Envoy for MHPSS. We would like a special envoy for that in Denmark, maybe one day. Nana Wiedemann, who's the director of the Reference Center for Psychosocial Support at the IFRC, and Michael Corlin from the Education Cannot Wait Fund, doing really incredible work to integrate MHPSS into education. In the 3rd session, we're going to look at advances in research, innovation, and practice, and we will welcome Dr. Wietse Tol from Copenhagen University, our longtime colleague and MHPSS champion, research champion, Sarah Harrison, who is the co-chair of the IASC MHPSS reference group for, with the guidelines that I just mentioned, she co-chairs that group that oversees the coordination of MHPSS within emergency response. And our own Anne-Sophie Dibdi, who you heard speak this morning, who's Senior Child Protection Advisor. So we thank you very much for being with us, and we thank you for joining our beloved community, and we look forward to continued interesting and insightful discussions this afternoon. Thank you so much.